Welcome back to our channel for Libra Aesthetics and Wellness. I'm Aisha Thomas, MD, the Medical Director.
And I'm Lisa Parker, the Nurse Practitioner.
And today's topic is healthy hair. So if you want to hear more about this topic, please keep on watching. By the way, you can find the information in the description box below, our website, our office location and phone number, our Instagram, our Facebook, so you can contact us for any consultations you may need. So let's go into it. So healthy hair. First of all, what is hair? So you can say hair is keratinized epithelium, to be kind of scientific.
Right.
But we know that hair grows pretty much all over the body, but we're going to concentrate on the hair that grows from our scalps. So let's talk a little bit about what hair is. So I mentioned keratin. That's the major component of hair. And hair grows in a cycle. Usually it takes about 2 to 6 years to complete a cycle.
Right.
So the first phase in the hair cycle is when the hair is growing. That phase is called anagen. So the hair is dividing. It really divides from the little root in the root of your hair. You know, if you ever have your hair yanked out and you see a little white bulb in there, that's like the root of the hair.
Right.
And that's where there's a little section where matrix cells divide and form, you know, the new hair cells that keep going up to the scalp. And people ask, is hair dead or alive? I guess it's alive in the scalp, but once it leaves the scalp and it comes out there, then it's dead cells. There's another little area called the bulge where the stem cells live in hair. We'll get into that a little bit more when we talk about treatments for hair loss. So remember that. So as we talk about anagen, so your hair may grow about average a centimeter a month. It varies in different races. It varies in different ethnicities. And that hair will continue to grow for an average of maybe, 2 to 6 years, as I mentioned. And then it will go into another phase called catagen. That is sort of like a little phase where the hair follicle shrinks a bit. It loses blood supply. And then what happens next in the next phase, which is called telogen, that's when we sort of lose the hair. The hair will fall out from the root. And some people, we lose about 100 hair strands a day. So it happens random. That's why we always have those clogs in the shower.
It's true. So true.
Now the last phase is called exogen, where the little new hair starts to push its way through the scalp. So that's in a healthy hair cycle. You'll find the hair goes through those phases, and you'll find that your hair will continue to grow. I guess we can talk a little bit further into types of hair, because with our wonderful ethnicities, we have different hair types, as you can see. Usually it's classified from type 1 to 4. Type 1 is straight hair like you, Lisi.
That's right.
Then you have wavy hair, curly hair like mine, and kinky hair. And these are the different types of hair. And the reason it makes that shape is so funny, it's just because of the shape of how it leaves your follicle.
Right.
So straight hair is round, so it just falls out straight.
That's it. Boring.
And then curly and kinky hair, we have those little interesting bends. So the hair comes out and makes a little curl, little kink.
I always want mine to look like yours.
And I'm like, I need to straighten this cloth out. Isn't that funny? So that's how you end up with the different types of hair. And managing it could be a little bit differently, because while, for example, type 1 hair, I guess they say the oil from the scalp can get down easier.
It's true.
Yeah, my hair, it doesn't do that. It sticks right up in here, and then I have to spray on some extra oil, conditioner, or gel to make it stay in place. You know how it goes.
I got no problem with that.
So when you get into the types of hair, it helps you to sort of know for management how to take care of it. Other things that's important for knowing about hair include your density. That's sort of how many hair strands are in a little square centimeter. Because when patients come in for evaluation, we do check the hair density. We look to see, in a square inch or something, how many hair follicles can we count, and see if that's high, medium, or low. And also porosity is important. It's pretty much how the hair absorbs water, because the hair has in many people a medulla, which is the center, and then it has a cortex, and it has the cuticle. So the cuticle is where those scales of hair of keratin lay, and they follow along the hair shaft. So knowing that helps to know how it penetrates water, gets in there, and it helps you to know how to manage your hair as well. And the other thing that could be important is the thickness of your hair, which is like the width of each strand. They say it's thick if you can put it between your fingers and feel it between your strands. If you can't feel it, then it's fine, pretty much.
Right.
So this is how you would help to assess your hair. And of course, managing your hair means, and having healthy hair means you need to have a healthy scalp, because that's where it grows from. So we can talk about the ways that you can benefit your hair internally by what you eat and the supplements and so on that Lise will talk about, and also the products you use on your hair, because different things will damage your hair, such as, too many chemical treatments, a lot of friction, like when you sleep at night, if you're crazy and wild,
ponytails.
Yes, tight traction things, tight styles can damage your hair. And the things that's beneficial for your scalp, of course, is very useful, such as massaging the scalp can be helpful because it's bringing the blood to the
Stimulation,
scalp. Also things like keeping a very clean scalp. So that means washing your hair. It depends on, I guess, the type of hair. Some people can wash their hair daily, but a lot of people have to cut it down to every 3 days or weekly. Or some people, I guess, even go longer depending on your texture of hair and so on. The other thing after you wash your scalp, of course, and your hair is to condition it, which is where you're trying to seal the cuticle and keep the moisture in. So for me, I like to, deep condition my hair at least once a week. Heat helps the product to penetrate better for me. I'm not sure what you do, Lise. Do you deep condition your hair at all?
I do. I try to do it probably at least 3 times a week.
Oh, okay. Right. There you go. So that's even more often. So
I really do. Because otherwise, because I have long hair and what I do, I have to look down quite a bit. So pulling it back, wearing braids, buns, which y'all see all the time when I make these videos, it's all the time back because I work down. So I definitely have to treat it quite a bit. Otherwise, the dryness, it causes my hair to kind of stick out and around, and I don't really like that look.
Yeah, I could imagine. Like for me, so for me, I mean, I like easy. So for me, I was trying to pull it back all the time, but I realized it kind of was thinning my hairline a little. So I said, you know what? Let me just cut it a bit and just go with the natural curl. So I've been trying to do that more. Just because it's easier, just wear it how it is, and try to.
The new haircut looks really good on you.
Oh, well, thank you.
It looks good.
I like the long hair on you. It looks
Thanks.
good. So at night, it's good to protect your hair. Like you can use like a satin scarf or I put my hair up in a ponytail on top of hair. So therefore, it'll just keep the curls there, and I was asleep on the pillowcase. I try to do it as a satin pillowcase. I don't know what happens to it, but I try. What about you?
I try not to fall asleep with the towel on my head because I know, as you were saying earlier about the friction, because when you do and it pulls, whoo-wee, that can
ruin a good night.
Yes, it really does.
Another thing to keep in mind, protect your scalp from the sun. Because down here in Florida, we don't think about it, but you can have, scalp cancers too. And if you're not protecting your scalp by wearing hats, I never put sunscreen in my scalp.
I do.
You do?
I absolutely do.
Well, that would be something. If you can put sunscreen to protect your scalp. I mean, the thicker I have, I guess I don't think about it, but it's good to do that, especially as we age and our hair gets a little thinner.
Correct.
And wear hats. Especially when we go
out
out
fishing, when I'm out boating. Yes, I do. I put it here, and I also put it on the tips of my ears because that's a place where a lot of people forget too. But I know we're talking about our hair tonight, but
that's
tips
smart.
of the ears. It's painful when it gets burned. Yeah.
Exactly. Another thing to do, of course, is for this condition of the scalp, we like to assess, is there a problem there? For example, sometimes the same way we talked about the skin, the scalp can be overactive and be extra oily or extra dry, or even have a fungal infection or bacterial infection there. So we like to assess the scalp, make sure it's clean, it's healthy, so the hair can grow out healthy as well. So what Lise will do now is go into a little bit about the treatments for hair that will be beneficial from the inside, because I talked a little bit from the outside, because one of the things we try to avoid is alopecia, which is just a scientific name for saying hair loss. There are different types of it. We talked about having tight hairstyles that can cause traction alopecia, where you lose it along the hairline and so on. When you have those tight braids, wigs, and other styles, they can pull on your scalp and your natural hair. And the other one is like an autoimmune condition, where your body sort of attacks the hair follicles in your scalp. And then that can cause an issue because you lose hair. And if the follicle dies and those stem cells I mentioned down in the bulge, then it's very challenging.
Right.
Because otherwise you may have some treatment options if you still retain that bulge when you have those stem cells. And of course, androgenic alopecia, Lise, I want you to mention, because that includes the DHT, which is a byproduct of testosterone that can cause hair fall. So tell us, Lise, what you want to add to what we discussed.
Well, with that DHT, so it's great that you mentioned that, because that kind of shortens the anagen phase of the hair cycle. So we pretty much want to make sure that you can have your hair live and grow as long as it possibly can. So it's great to know that there are some foods that are out there that can help with that process. So if you're finding that your hair is starting to thin and stuff, we always talk about giving the advice of starting with your food and your supplements. So I can definitely start there this evening. So we got a couple of them. I know that if you do almonds, so almonds is great because it has a great source of biotin, and it's also known as the quote unquote hair vitamin. So the hair follicles can become weak, and they can become dull. And sometimes you may see a little bit of dandruff on your scalp if you're noticing that you're not making enough oil production. So vitamin E from the almonds can actually help with the lubricating of the hair follicles. So it can give you shiny looking healthy hair. So that's good. We also have eggs, which are also rich in biotin. They contain proteins that actually bind to biotin, and that's great for hair growth. And it's also found in hair keratin, which is great to keep your hair nice and strong. So we know that strong hair can live a long time, 2 to 6 years, in fact. So you want to make sure we do that. And since it is fall and pumpkins are very easy to find right now, pumpkin seeds. These little munchkin pumpkin seeds, they also contain essential minerals. They have zinc, magnesium, and iron, and amino acids inside of them that also help with hair growth. So I thought that'd kind of be a fun one to mention tonight, like I did with my smoothie last week, which I did try, by the way, and it was really good.
Oh, I haven't gone
Thank you very much. Yeah, I did. And you were right, it was a little sweet, but very good. And it also has L-lysine, iron, and omega-3 fatty acids. So that also helps with the quality and the texture. So toss them in a salad, put them in the oven, bake them up just a little bit, have them as a nice little snack. So that can also help with hair this week. So I was looking here too, and I also talk about green tea quite a bit. So I was happy to see that green tea, along with the digestion, along with everything else, the weight management stuff, we've talked about it quite a bit. It has vitamin B, which is something that we use a lot in hair conditioners. So it's got antioxidants in it, and it helps stimulate hair growth. So these are great from external damage and also internal damage. So keep up with the green tea there. So how about that for some foods tonight?
Yeah, I like that. One like a little fun fact. I was looking it up, and it was like, people are saying my hair turned gray. What can I do about that? And the gray color, the white color, is just a natural color of keratin without melanocytes. So the melanocytes are what colors your hair. So that's why people have different shades of hair and different, the eye and the skin color is all from melanin that is made from those melanocytes. So when those die off in the scalp, you'll find that your hair will just look gray or white because that's the color of keratin. So you can help to reverse it in certain occasions where you can help the melanocytes recover. And of course, with vitiligo, you see it on the skin where you have those patches of white on your skin. So it's sort of in the same ballpark there. Isn't that something?
Yeah, that's pretty cool. So let's see. I was looking here, so we've got some vitamins and supplements because, like I always mention every week too, we do have Full Script, which is our supplement company that we work with, and we work very closely with them. I just love the support that they provide us. Anytime we have questions, weekly updates, stuff like that. So once you become a member of Full Script, once you become a member of Libra Aesthetics and Wellness, you also become a member of Full Script when we start sending you supplements. So the information that gets passed along on a weekly basis is so beneficial to your life. So
yeah, because we're making up the Healthy Hair program for supplements, and you can, call in, and we can, of course, put you on that program.
Absolutely. And vitamin D is actually great for the cycling of the hair follicles. So especially for individuals who live up north in the United States, where sunlight is limited. So, we get plenty down here, but some people have issues with the conversion. And plus we found out with a lot of vitamin D testing, which Dr. Fossey's even mentioned because of what's been going on with the virus here lately, it's important to get your vitamin D level checked. And we actually do that here in the office, and we actually do have it injectable, and we also have it in oral form through Full Script. So just throwing that out there. Zinc is also great because people who are heavy exercisers and sweaters actually lose large amounts of zinc, and this is actually a hair growth mineral. So it's important to make sure that you've got high high levels of zinc, about 30 milligrams a day or so, just a supplement in order for you to take in order to keep your hair nice and healthy. Of course, your B complexes, which we've talked about with the biotin as well. And a lot of people like to take prenatal vitamins.
Right.
And those are great to take because they're packed with all kinds of essential vitamins and minerals. So that's what I've got for you tonight.
Sure.
Oh, I wanted to say we also do carry shampoo. Of course, there's medications that can help along with additional treatment options that we have for you, but we also do carry a supplemental shampoo that works along with your treatment plan here as well, which is great because it helps with the conversion of your testosterone. It helps block the conversion to the DHT, which we all know kind of thins out your hair and kind of slows down the amount of blood that actually gets to your hair bulge, which helps it grow. So we've got that to also add to your regimen. So we can kind of get it from all kinds of angles. We get it from your food, from your supplements, from the topical shampoos, and also some of our topical treatments. So
because Lisa's talking all about the natural stuff, because that shampoo has saw palmetto, which is great for blocking DHT.
Right.
And of course there are other medications that we can prescribe if necessary, like ketoconazole is prescription strength, can be useful in helping block DHT and also treating seborrheic dandruff and other things on your scalp. And of course, there's other things like histamine blockers like cimetidine, and there's minoxidil, which also blocks DHT. And if we need to go further down the line, we can do a little compounded treatment with a little bit of steroid depending, a little minoxidil. We'll find out what you need according to your hair's texture, density, and the assessment we do. We'll also do lab tests because we find that hormones also affect how your hair reacts and what happens with hair fall.
That's right.
And hair loss. So when we see you, we'll check, your iron level, we'll check your thyroid, we'll check your LH, we'll check various things that we think could be affecting your hair to determine whether or not it's autoimmune or what the case may be.
Right.
Some cases people may need a scalp biopsy if necessary. And in terms of treatment, talking about that bulge, the bulge I mentioned next to the follicle there, which has those stem cells. So getting back to it, there's a fantastic treatment such as PRP, platelet-rich plasma, which can activate latent stem cells or cells that are senescent or almost dead. You can tell them wake up again, give them those factors and growth signals they need. Some life. Wake them up and help them to get your hair to grow again. So that's a treatment we can offer here, which is very exciting.
It is exciting.
And other things that they include some lasers, some hair scalp caps that you can wear, certain things like that. We're talking about maybe investing in that. It depends. And going down the line, of course, there's also hair transplants where they try to get hair from other areas of your scalp that's more dense and try to put it into other areas, because you find that men and women, they have alopecia or balding in certain patterns. So we go for the classification, like women is the Norwood classification and so on. And then you can see there's a male pattern balding and so on, and we can decide whether or not if you're a candidate for any of these therapies.
Right.
And things keep evolving all the time, so I feel like that's why it's important in wellness, so we can keep up to date.
That's right.
So I'm glad you joined us here today. If you have any questions, please leave it down in the description bar. Any questions or topics you'd like us to address in our next videos. We love doing these for you guys.
We do.
It's a little educational, and it's a way for you to reach out and for us to give back as well. So remember, our website is down below. Reach out to us. We can do consultations for you guys, and we'll be happy for you to join us here at Libra Aesthetics and Wellness.
We are.
So have a great week.
Thank you. See you next week.